Hello everyone, I'm Kim, as Tony said, and I'm going to be talking about aging gracefully, the benefits of physio for older cats. So just to prove my crazy cat lady status, which bless her, Tony was more polite than I was about, these are all of my brood that I have right now. I've had cats in my family and in my household since I was 3 years of age, and I absolutely love them. So these are all my brood I have at the moment. I have Bod on the far right. He's the eldest. None of these guys are very old, but they all have their own disabilities. My previous cats lived to 21, 20, and 19. So they've not done badly. And I think I probably know a little bit about elderly cats. These guys are all 4 and less, but they've all got their own disabilities. So they're kind of old in young bodies in a little way. So Bod was my first guy. He only has 3 legs. Stanley is my next. He has all of his legs working now, but when he originally came to us, to the Ralph, he was not able to use his back legs at all. He was totally paralyzed, and we've got him back walking. Betty is my gorgeous, judgy female who rules the roost. And she can use all 4 of her legs, but her back 2 are flat. She's completely flat-footed and can't walk properly, but she does a darn good try at it. And then Kevin is my youngest. He's my little parrot cat because he loves sitting on my shoulder like that. And he's only got 3 legs as well. He ended up having one of his hind legs amputated because of a birth deformity. So anyway, you don't really need to know more about them, but I like showing them off because I think they're cute and beautiful. So age is not an illness. It absolutely isn't. That's my lovely old lady Jess, just before she passed away at 19 years of age. She looks a bit scruffy and scrawny there. She had, by the time she left me, she had chronic kidney disease, hypothyroidism, and a lot of arthritis, but she still had the ability to thoroughly enjoy herself when she wanted to, and still tried to catch the odd bird, although she was less successful the older she got. So first of all, I wanted to talk about, I'm not going to go into what these mean and what they are, but these are all possible problems that the elder cat can get. And these are things that some of them physio can't be remotely useful for. Some of them possibly they can. The research is sadly in animal physio quite limited. So I am obviously a human qualified physiotherapist. I spent 10 years working in the NHS before I went off and did my my master's level degree in veterinary physio. So it's not 100% accurate to say that if it's true in humans, it's true in animals, but there may be a relationship. So it's something that may be worth thinking about. So I've sort of made the fonts bigger or smaller, depending on whether or not I thought that physio might actually be useful. So arthritis, 100%, we can help with this. I have absolutely no doubt in my mind that physio is massively beneficial for arthritic patients, whether they are dog, cat, human, anything else in between, and no matter what their age. We should not be thinking because they're old, they're getting slower. Like I said in the last one, age is not an illness. And sometimes we are all, myself included, guilty of going, oh, but they're old, so they must be slowing up. Oh, but they're old, that must be because of that. Sometimes it's not necessarily. Sometimes it may be an illness that can be treated, whether that be medically, whether that be through physically, through physiotherapy. You know, there may be something we can do to help that doesn't necessarily, you don't necessarily just want to write it off. So arthritis is, in its most basic form, joint degeneration, wear and tear on the joints. Now that makes it sound scary potentially, and makes you maybe want to stop letting your animals move around too much. That's absolutely not the way to think of it. A cat has to be a cat, and you've got to just have a life and have a good quality of life. And if that means that by the time they get extremely elderly that they're going to start showing some arthritis, that's fine. We can manage that. We have medications. The vets have the ability to prescribe various medications. We have various operations that they can do, and physio can also help with this. There's other things that are very common in the elderly cat. So you can have, I'm going to go through the things that physio probably don't have a lot of ability to help with. First, so you're going to get sight and or hearing loss. They may get both. Dental disease, really important thing to think about. It's not just they're a bit old, they've got some teeth that aren't working as great. Because if they can't eat because it hurts them, then that can really affect their whole of their physical ability and their whole of their their lives and their quality of life. And that's what we're talking about with these elderly cats, is we want them to have quality of life. It's worth noting that none of the problems and diseases and physical processes that I've got up here are curable, but they are controllable and manageable. And that's really important in the elderly animal, both dog, cat, and human. I'm not going to talk about horses. I don't do horses. I've stopped doing them many, many years ago, although I trained to be able to do them. But I'm mainly talking about cats, but because I'm human trained, I always hark back to all of the species. So dental disease is an important thing to be on top of and think about. You can also get inflammatory bowel disease, pancreatitis, hypothyroidism. These are all things that your vet can help your cat with. And it's really important that if you're worried about any of these, that you go and speak to a veterinary surgeon. The other things that I've put slightly larger are because in human research, there's actually some pretty strong research that these things can be helped with exercise. So I have zero proof that they can help, that exercise can help in the cat. I will say that right here and right now. But there is definite good evidence within humans that getting active and exercising can help control and sometimes improve the signs and symptoms of chronic kidney disease, diabetes. Exercise helps level blood sugars quite significantly. Regular exercise, not a one-off, that's not going to help at all. But regular controlled exercise can really help with leveling blood sugars with the support of your physician / vet. None of these should be being things that you're doing and then not having veterinary advice for. Please, 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 your vet knows what they're talking about. You need to be liaising with them for these things. Constipation, bowel habit absolutely improves with exercise and movement. It stimulates the gut, it improves gut motility, and can really, really help. And elderly cats, unfortunately, do have problems with constipation. Heart disease. In humans, we do lots and lots of cardiac rehab. If you've got any form of heart disease, whether that's congestive cardiac failure, whether that's post myocardial infarction, which is very, very uncommon in animals, but cardiac failure can definitely be a problem. And we do know that the research in humans does show that exercise can help, and cardiac rehab is available in pretty much every general hospital. And we also know that cognitive dysfunction, which is essentially dementia in humans, also regular standardized exercise can be massively beneficial. Now, as I said, other than arthritis, I have no proof for any of these for exercise being helpful in any of these within your cat. And you absolutely need veterinary interaction and support while you're doing this. But if you're doing it in a controlled and sensible manner, then it might be beneficial. I think this is a really great thing to work out whether your cat is painful or not. And this is probably mostly about arthritis, but it's not a specific pain scale for arthritis. It's a pain scale for just pain in cats in general. It's There's an app. So if you go to, I've put the website up. If you go to the website, it will give you the links to both Apple and Android apps. So this is something that you can download. It's a really good app and it has good teaching aids. They've done research recently. It is something that vet practices use, but it's also something that the research has shown that in actual fact, this works really, really well with the layperson, the pet carer as well. And it walks you through it step by step, and it can give you some real help to know whether your cat is in pain or not. Cats are really tricky to work out whether they're painful because their signs are so subtle. If you look at any of these, look at the difference between, especially sort of the middle one, muzzle tension, the difference is very, very subtle. It's to do with, and you're looking at whisker position, you're looking at really, really sort of subtle facial signals to tell you whether or not you think my patient, your cat, is uncomfortable or not. And if you grade these and you do it's a really simple, very quick training, and it just tells you how to use this scale, and it can be really useful. And then you can go to your vet and go, I'm worried. I think my cat's in pain. They are showing this, this, and this, and this. And then you can have a slightly more educated discussion. And it may be that maybe they're not as active, not because they don't want to be, because they're just old, but maybe they're a bit ouchy. And that's a really important thing for people, pet carers especially, to be aware of, because ultimately the reason you're the person that would decide to take your cat to the vet or not. So I think this is a really nice, easy visual scale that can be really, really helpful for you to have an idea of whether you need to do something to assist your cat, or whether they're just, how sore are they? And that's always a good thing to know. I always want to know if the animals I care for are in pain, and if I can do anything about it. In not thinking about whether your cat's old or not, we're just talking about cats in general. Are they a tree cat or a bush cat? Now, there is no real science behind this, but there's a few cat behaviorists that have sort of started talking about this, and it does sort of it's I think I've seen enough cats and I've been around enough cats that it sort of is worth thinking about. So the theory is that, does your cat like to hide in a box on the floor, or disappear around behind the sofa, or be in a corner but at foot level? So these are your bush cats. These are the cats that don't need to climb, don't want to climb, but they want to be hidden. So they can see you, they're protected, they feel enclosed, they feel safe, but they are still interested and can survey their environment. So these are your bush cats. And I'm not entirely convinced about this bit, but some of the behaviorists will say that these relate to sort of bobcats and sort of wild cats, that this is the behaviors that they display. Or are they a tree cat? So this would be the cat that loves to be as high as possible. Now, whether that's at the top of the cat tree, whether that's maybe just on a windowsill, whether that's they used to be at the top of the kitchen on top of the kitchen cupboards, on top of the door. I've seen all sorts of things. And a cat that's determined will get wherever as high as they can if they want to. But these are the cats that feel safe being able to look at you from down and look look at you from up above, look down on you, and be king or queen of all they survey. This is important because if your cat used to be a tree cat, especially because we're talking about the elderly cats, if they used to be a tree cat or they used to be a bush cat and they've suddenly stopped being this, then maybe there's a reason for that. And maybe that's something that is giving you a sign that they need some help. And that's something to be thinking about and worried about, or, you know, hoping you can help address in some way or form. Most of us, and that's not to say, you know, I've got out of my four, I've got some that don't mind doing either, but they definitely have a trend towards either liking to be up high or liking to be down low. And I think when they change that behavior, you kind of have to then think, okay, why are they changing that behavior? Is it just because another cat's been on their high perch and they don't like the smell anymore? Or is that because they physically can't get up to that high perch anymore? Possible behavior adaptations. This list is not entirely comprehensive. It was as many things as I could think of, but that's not necessarily to say that there aren't others. But if you suddenly notice that your cat who is advancing in years, and this can be, I mean, I know I've been talking about how my cat's got to 19 plus, but that officially in veterinary terms, which upsets me and horrifies me greatly as a cat lady, anything from 8 or 9 and above starts to get into the realm of elderly cat. So this can be any pet, you know, any cat that's from sort of 8 and up. If you notice that actually over the last few weeks or so, they look a little bit more stiff, they're struggling to walk, they're not wanting to run anymore, they're moving slower than normally, they look stiff when they first get up, and it may be that they're only stiff for 2-3 steps and then they sort of shake it off and they're okay. I'm not necessarily talking about the cat that stands up and has a big stretch and does your big sort of bum in the air and big stretch and all of that, unless they're doing it more than they have done for the rest of their lives. You know, we all like to get up and stretch every now and again, but if they're looking really stiff when they first start to walk, that might be something. A reluctance to play where normally they would be happy to do so. If they can't settle, and I know some cats are very nocturnal, some cats aren't. I mean, most cats tend to be more nocturnal. I do appreciate that. But if where you would normally expect them to be resting, they're struggling to do so, that's sort of the thing we're talking about. Struggling with going up and down stairs, or just choosing not to jump anymore. If they're repeatedly licking joints, that's a sure sign that potentially that joint is hurting them, and that's why they're over licking. You can look at over grooming areas. That doesn't necessarily equate to pain, but it is a worry, and it's something you need to think about. They shouldn't be grooming themselves to the stage that their hair is disappearing. Changes in mood. They become aggressive, especially when you go to stroke them and touch a specific part of their body. So it may be that suddenly you go below their waist and they don't like it at all. That is something that you need to be thinking, okay, maybe that's sore when I touch. Maybe they're worried. It may not be sore when you actually touch. It may be that they're anticipating that soreness, and they're thinking, okay, if I tell you to get lost before you actually make me ouchy, then I'm all good and I won't be painful anymore. So it may not be just becoming more aggressive towards you, it may be telling the younger cat or the dog or the other family another pet member to get lost where they wouldn't have done so before as well. That can sometimes be an indication. If they're hiding more, some cats that are in pain or not feeling great, they don't, especially, I mean, again, we're not going 100% but if they're what you would call a bush cat, if they like hiding in the first place, they may well just decide to disappear more, because If you can't see them, you can't touch them, you can't make them move, you can't make them hurt. And that is a big thing. Sleeping more. Now I've put an exclamation mark after this because let's face it, how much do cats normally sleep anyway? It's quite a lot. But if you notice that your cat is sleeping a lot more, some cats have activity trackers on them or GPS trackers on them. So if you suddenly notice that the amount they're moving around or their steps are lower, significantly lower, consistently, not one day, not a couple of days, but if they're consistently lower after a week or two, then maybe you need to think about why that is and what is occurring. Changes in where they sleep, where they relax. So again, this is to do with what's comfortable for them. Did they used to like to sleep at the top of the cat tree, or did they like to sleep on top of the, kitchen cupboards at the top, or what? Or did they used to love the hard kitchen windowsill or any windowsill, and now suddenly they're choosing the softer, um, more comfortable sofa, that sort of thing. Is that because it hurts when they're lying on a hard surface or a cold surface compared to a softer, warmer one? Poor grooming is a really big sign of an elderly cat struggling in some way or another, especially around their bum and in between their legs, because they have to be able to bend their whole spine to get their head down there to groom. So it may be that their top half looks fabulous, but their bottom half is looking a little bit more scruffy than usual. And you need to think about that and see if that's something that, if there's a reason for that. The other reason that might be, it may not just be pain. It may be that maybe they're a little bit too fat. And that goes in with the weight gain. So unfortunately, just like us, the older we get, the more likely we are to gain weight, due to number of reasons, hormonal changes, metabolism changes, and also just lack of exercise and lack of activity compared to what we used to do when we were young, fit, and energetic. So if you're noticing, sometimes if they are gaining weight, then that isn't a great sign. Equally, if they're losing weight, then that's really not a good sign. That can be a number of medical problems, and they absolutely need to go to the vet ASAP if you're noticing that your more elderly cat is losing weight. There's lots of reasons that can be, and there's lots of medications and treatments and things that are entirely in the vet surgeon's remit to do, not mine. However, weight gain is not a healthy thing either, and that may relate to why they're struggling to groom, because they've got if we've all got a bit of a belly, then it's more difficult to bend down and touch your toes, and it's the same for cats. Well, I'm afraid. And then the other thing might be toileting outside the litter box. Now, there's many, many, many reasons why a cat might start to do this. It can be anxiety, it can be medical, but it can also be maybe they're just feeling a little bit too creaky to step into that really high-sided litter box they've got. And I'm not, you need to investigate fully the reasons why they're doing this, but it might be that one of the first things you do is look at, okay, maybe if we make the litter box a little bit less cool to get into, will they still use it? And if they don't, then you absolutely need to be getting to your vet to find out, to investigate further. As you've probably got from what I was just saying, there's lots of potential environmental adaptations that we as pet carers can do to help with our aging pussycats. So I've got various little pictures here that I'm going to sort of talk through. So your cat tree at the top. If you've got a tree cat who loves sitting at the top of the cat tree or the top of the kitchen cupboards or whatever, just because they're getting old and they're not able to jump anymore, that doesn't mean to say you can't facilitate them to be able to still be a tree cat. So if you see the cat tree that I've put the picture of there in the top left, it's got ramps. So they don't need to be able to jump. They need to be able to walk up those ramps. And then they can jump from step to step to step. And those are smaller jumps. They're not a big jump. So we're no longer asking them to go from the floor to the equivalent of the kitchen worktops and then then the same jump again to the top of the kitchen cupboards. This means that they can still manage the behaviors that they want to do without needing you to help them do it, but also they can still be happy, they can still be stress free. The reason a cat wants to be up tall is to do with, this is where I feel safe, this is where I want to watch my environment. So if you can provide them a cat tree that gives them the ability to still be up high but without the physical exertion, brilliant. They're going to love you for that. I mean, they're going to love you anyway, but they're going to love you even more for that. So in the same way, the one to the side, the picture to the side of the very fake cat on the steps. So this is showing steps up to the bed, which absolutely that can be a thing, and it can be very, very useful. I would preface this by saying that I've got all of these, or many. I've certainly got the cat tree with the ramps and the steps, etc., up to a lot of my furniture in my house, because I've got cats that are all, they may be young, but they're disabled, as I said. So they've got good, strong front legs, but they don't necessarily have useful back legs. Exactly the same applies for your aging cat. Those steps are not just necessarily useful for beds. So most of the steps are like the ones at the bottom where you've got the pussycat coming down the steps. I quite like those ones as well, because you've got the added bonus of having a hidey hole for them underneath the steps, so you can have a 2-in-1 with that one. But equally, they can get that sofa height, so that means they can get up and off the sofa, up to and off the sofa more easily if they need to, and hopefully save your sofa somewhat, because they won't need to use their claws to drag themselves up onto it. However, the other steps at the top, these can be useful. You can get these tall enough, and these are just from Amazon. They're not anywhere exciting. These can be tall enough to get up onto a window ledge. So if your cat had a favourite place resting on the window ledge and they can no longer jump up, give them some steps. And it doesn't have to necessarily be actual steps. It could be a footstool, and give them, just give them a halfway jumping height so they can manage to get from there to there. And you can still facilitate them to do the stuff that they want to do, but safely, and make them happy, and obviously, hopefully, make you happy, because you're making your cat happy. In the far right, that's the sort of cat litter trays I'm talking about. So you can easily get, I found those 2 different options just by putting in low profile cat trays for old cats, and they came up immediately from Google, different shopping options. So you can find them easily enough. It does mean that maybe you're going to end up with some more cat litter strewn around. You can get yourself a cat litter mat that goes around, or some of these things we have to sort of swings and roundabouts. We have to put up with some of these things, because obviously you have the higher trade cat litter trays to facilitate their ability to not chuck litter everywhere. But if they can't get into it in the first place, maybe the lesser of 2 evils is a bit of cat litter on your carpet versus poo. So yeah, sorry. So then I've got the cat in the middle at the top, the cat bed. The reason I quite like this one is these are for your bush cats, or any cats that love a cardboard box, love to hide. you know, this can be any cat, most cats in all fairness. The reason I quite like this one is that it may be difficult to see, but that grey strip around the middle is actually a zip. So if you need to get to your cat for any reason, you do not have to manhandle them and drag them out of it. You can just unzip the top. And that makes life so much nicer and so much healthier and happier for both you and your cat. The same goes for choosing, which I haven't got a picture of here, but the same goes for choosing the correct cat carrier, in that you really want a cat carrier that you can open the lid off, so they can go in either through the front or through the top, because some of the cats will only want to come out by being, or won't want to come out at all, and maybe you need to facilitate them out by picking them up. That's much better to do from the top than it is from dragging them out from the front. And equally, you may have the same issue with getting them in there in the first place. I put some cat clippers down the bottom. So everyone will be, and obviously if you've got cat trees, etc., you'll be giving your cat the opportunity to sharpen their claws themselves. However, you need to think about what is most beneficial for your cat, whether you want to clip their claws to make them less sharp, but you do need to realize that if you do that, that will significantly decrease their ability to use their front legs, especially if you're clipping their front claws, will decrease their ability to climb and drag themselves up with their front legs, which is not necessarily a bad thing. Some, cats can use their front legs, and if their back legs are weaker and suffering, they can still climb by pulling themselves up with their front legs. One of my boys, who can only really use his front legs, Bod, he can get to the top of a cat tree similar to the one in the top left-hand corner purely on his front legs. Now, granted, when he gets older, he's not going to be able to do that, but I absolutely cannot cut his claws and keep them, not have them sharp, because otherwise he cannot climb, and that will significantly reduce his quality of life. I also need to accept that my sofa's quality of life is not very great, but frankly, I'll go for Bod's quality of life rather than my sofa. Having said that, the other thing you do need to make sure is an elderly cat may not be using their scratching post as much as they should be, and their cat claws might actually be getting too long. And if they're too curved, then they can actually cause more problems, and they end up getting their feet caught in things too much and too frequently. And that actually may be more detrimental than clipping them yourself. So you very much need to be, again, it's a thing of it's specific to your cat, it's specific to your cat's behavior, and you need to be aware of what you think the best thing is. The worst comes to the worst and you get it wrong, they're going to grow back, so don't panic too much. And then I've got cat toys. We're going to talk about toys later, but exercising them. Don't stop using toys, and sometimes start using toys, because if you can get them moving, that's fantastic. Any movement equals good movement, whether that's 3 seconds or 3 minutes. If you can encourage them to move, to play, to do anything, that's going to stimulate their brain, that's going to stimulate their muscles, that's going to help with their bone density, because it's going to get them weight bearing, it's going to help with weight control, all of the things that I'm talking about. The most basic form of exercise for your cat is to get them active. So playing is the best thing you can do for them, in moderation. I'm going to be a nightmare, and I'm going to say everything with, yeah, it's brilliant, but don't do too much, but don't do too little. It's one of those things, I'm afraid, and I'm really sorry, but that's what happens. And then the final thing is 4 weird looking little squares in the bottom corner. These are heat packs. So these are the Wheatie bags that you can put in your microwave, and an arthritic elderly cat with sore muscles will absolutely love heat. Having said that, if you give them the option of heat and they walk away from it, don't chase them around the room with it, because they've told you, I don't, I, they've told you no, and a cat knows what it wants. So just listen. I'm going to talk to you. So this is the lovely Aggie, who you will maybe have seen in my ad earlier on that we did. She is an elderly and arthritic lady of, I can't remember her exact age, but I feel like I think she's about 15 years old-ish. But she's had a broken hind leg in the past. So she's got some pretty nasty arthritis in at least, well, both of her back legs, but one worse than the other. And she's a bit sore in general. So I'm going to start playing this because this is quite a long video, but I wanted to show you that some cats will tolerate a heck of a lot of massage and everything. So if you notice, I started with some stroking. That stroking was not the light, normal stroking that you would do. It was stroking with a little bit of oomph. So you're trying to give them a bit of massage while you're doing it. She's not 100% sure right now, but she settles down and she's tolerating it. I'm not restraining her in any way. So if she didn't like this, she'd be up and she'd be gone, and she's letting me do it. I will also say that she's an old hat at physio and she comes and sees me a lot. So I'm doing a stretch here. So what you will find is if they've got sore back legs, you might well find that the muscles on the inside of their thighs, their adductors, get a lot tighter, because that's what they tend to do, is they tend to hold themselves tense and tight and hold their legs together. You don't very often see cats walking around with their legs wide apart. So they're the muscles that tend to get more tight. And then the other stretch I'm doing right now is a hip extension stretch. Arthritic hips especially get really tight in extension. If they're tight into extension, so that simply just means pushing their leg out back like I'm doing, then that's going to make them struggle to jump and run. So giving them a stretch, that can really help. So now I'm just massaging the back end, you will see. So the golden rule to massage is it doesn't have to be technical. It doesn't have to be textbook. It needs to be firm but comfortable. I'm not talking a sports massage that's going to make you cry, because your cat's going to bite you, scratch you, or just run away and tell you no. It needs to be firm. It's not a stroke. It's not excruciatingly painful, but it feels nice. You've all had a massage, you know what I'm talking about. You're not going to be digging your fingernails in. You're not going to be digging your fingers in. It's flats of fingers, flats of hand, web of thumb, even like the heel of your hand. With a cat, less so. That's more sort of dogs and humans. So now I'm on the front legs. So can you see I'm right up in her shoulder and then right at the back of her shoulder blade. She's getting really into this and really quite enjoying this. Cats and dogs don't have a shoulder, so they have a shoulder, but they don't have a clavicle, so they don't have a collarbone like us that attaches their front leg, their arm essentially, to their body. So they just have really big muscles that hold their scapula, their shoulder blade, onto their rib cage. So at this moment in time, what I've done is I've got my hands around her scapula, around her shoulder blade. So I was going backwards and forwards, and now I'm going up and down. That should have a glide. So if you look, it's quite stiff at this moment in time. It doesn't really want to move. And this is what I was talking about with long claws. She's getting her dew claws caught. Now, can you see this second time that I'm moving? There's a much smoother glide, and it's much easier the way that that arm is going backwards and forwards. And she's like, oh yeah, that's not so bad. Not 100%, but that's not so bad. You can get not just their back legs and their front legs, you can go down. So you've got to give them lots of positive reinforcement at the same point in time. But then you can go, I'm in her neck there, so I'm just massaging either side of her spine. And then you just gradually go down the whole of the spine. There's no right way or wrong way to do it. It's not do the front legs, then do the back legs, then do the spine. It's what bit they will tolerate at that point in time. And it may be that you've got a cat that will not let you touch their back end. Well, that's fine. You miss that bit out. And it may be that after you've done 3 or 4 of these sessions, they'll actually go, oh, actually, Kate, I trust you and I like this enough that I will allow more. Now look, she's lying down. She's going, oh yeah, I quite liked this. This was quite good fun. Let's do a bit more. So she's letting me move and she's letting me do this. She does tell me off now. So her elbow's a bit and her shoulder's a bit sore. So, but again, she's crying and she's talking to me, but she's not actually running away. In a second, she really tells me that she doesn't like her elbow being stretched. But there we go. She's like, no, stop it, seriously. But, you know, a bit of positive reinforcement and a few strokes and a bit of a calm her down. And she's totally happy to continue to let me do it. I'm not restraining her here. I'm letting her move if she wants to. And she's choosing to stay where she is. She doesn't want to disappear. Obviously, I'm only showing you one side here. It may be with a cat. Less is more. With cats, you'll frequently find that you can't do big sessions like this. I mean, this is quite a long time for a cat. The reason I'm messing around there is sometimes if you facilitate their natural movements, like her scratching her ear, like I was doing there, she will tolerate it a bit more and they'll allow it because it's a bit more familiar. But you know, frequently you'll find you'll only be able to do one side like this, and then you'll have to leave them to it and let them fill out whatever. And then it may not even be until the next day that you do the other side, but you just need to remember and make sure that you don't just always do one side because otherwise they're going to get very wonky and a bit sad. But you know, I did a little bit on the back end. She didn't want me to. She got fed up. I went up to the front end. We went back down to the back end. If you can stroke and do these big, long stroking movements that I was doing there, but with a bit more oomph and a bit more firmness behind them, you may well find that even the most intolerant kitty will allow you to stroke them, but it's a more therapeutic and a more massage based stroke. The other thing to do is use a heat pack either before or after, preferably before, because that will help make the muscles more relaxed. And maybe that's all you can do to start off with, and that and some stroking. And you've got to get them used to it. As I said, Aggie's been coming to see me, not frequently, but sort of every 2-3 months at least, for a fairly long time now. So she's a bit of a pro at knowing what I'm going to do, and she's now got to the stage where she knows that she feels better afterwards. And your cats are not silly. If they work out that it feels better after the massage, they will let you do it. Massage has some really good proven analgesic techniques, and if it's done it only needs to be done once a week regularly, and then it can have a good analgesic carryover for quite a significant amount of time. So these are some exercises. These are some general things. So this one looks really, really small, really, really simple. This is actually a neurological pussycat, but he was elderly, and this is relevant to some of the elderly cats. So please ignore his front leg bending over like that. That's because of the neurological problems that he was having at that point in time. But also notice that when I do go to correct that leg, I don't just correct it. I try and reinforce him and get him to do the correction. That's really important. But what you could do with your cat is just get them. So using the treats to move their head to side, that shifts his weight from side to side. Equally, I'm just gently challenging his balance by making him go from side to side. Something as simple as that, either in sitting or standing, can make a massive, massive difference. If your cat doesn't have a great core, and that's what that is helping with, And when we get old, our postural muscles, our core muscles do tend to become weaker quicker because they're the ones that are weakest already. They're not big muscles, they're not powerful muscles. Then they're going to really struggle to move because their core is not there to be able to do it. I don't have a video of this one. This is just a thing. One of the if you've got a cat that's really reluctant to interact with you, but you want to strengthen their back end, if you scratch their bum and they like at the base of their tail especially, and it makes them automatically their bum in the air, keep doing that. That's cat squats. And they won't even realize they're doing it, and they won't mind they're doing it. The reason they shove their bum up in the air is because they're enjoying what you're doing. So, give them a scratch, stop. They'll go back down. Give them a scratch, they'll come back up. Cat squats, go for it. If you've got, again, this is good for a good strengthener for the back legs. So we're looking at getting if you've got their front legs up on something, they have to put more weight on their back legs. Now I'm trying to get this little guy, that was really quick one. Let's see if I can play that again. Oh no, it's not going to play again for you. But I'm trying to get that guy to move his head from side to side. Again, that shifts the weight from one leg to the other, which helps bias whether you want to strengthen the right hind or the left hind. Equally, just get them, if you're worried about your cat and you want to get them stronger, put their food up on the second step of the stairs and get them to stand like that to eat. Perfect. That will help. So pelvic raise is basically exactly the same, but this is strengthening the front legs rather than the back legs. So we are going to come down and we're going to do exactly the same thing. So he's got all his weight on his front end here, and then you can move his head from side to side to shift his weight from side to side if he's got one leg that's weaker than the other. If not, just keep him in the middle. That's fine. But it will be a good strengthener. Stepping over is a brilliant thing, is a brilliant exercise. It looks simple, it doesn't look like much, it's absolutely great. It has multiple things. It strengthens the front legs and the back legs. It helps them so they have to do two things. They have to be able to support their weight with one leg while they step over with the other. And then the one that they're stepping over with, they have to have the range of movement to lift up and over an object rather than just walk along the ground without actually having to pick their feet up necessarily. So, and it does that to both the front legs and the back legs. Cats, all of these cats in my videos are very good cats that are like, I hate to say this, but it's the best way I can describe it, are quite dog-like in their activity, in that you give them a treat and they will do what I ask of them. A lot of cats are too clever for that, and they're like, yeah, no, food's not good enough. But that just means that you have to be a bit more creative. So something like the stepping over, I will say to people, you need to put the whatever it is, rolled up towel, draft excluder, whatever, either like over a doorway that they always have to walk past or walk through that doorway. So they have no way of getting through the door unless they step over it. Or you put it in a barrier around and put their food on the other side of the barrier. So they have to step over the barrier, which is again just a rolled up towel or whatever, or pole, broom handle, anything, in order to get to their food. So it's not necessarily you're actively doing what I did in that video of here's a treat, step over these 4 poles or these 4 obstacles. It's you turn it with cats, you have to be cleverer than that because they learn to avoid. And so you just basically have to turn your house into an assault course, and I take no responsibility if you fall over the obstacles that you've set up. You have to remember yourself, I'm afraid. So jump up. This is for your cat that is maybe only just starting to struggle, but actively encouraging them to do jump up and things like that. So you put the treats, you put the food, you put their favorite toy up on the step, up on the sofa, up on the thing. Encourage them to do that. It's not a bad thing to to get them to do. If you want to make that more tricky, you can either make the jump higher, or you can make the floor that the surface they're jumping from softer. So you put a cushion on the floor. And if they've got a cushion on the floor rather than a hard floor, that means that they have to use more effort to push themselves up and onto that surface. That's great. Do that. If your cat is still jumping, but not jumping as high as they used to, continue to do this. They've got the ability, encourage them. So going upstairs, again, it's the same sort of thing. This weights the back end. Going downstairs weights the front end. So it kind of depends. So you may want to be doing both, because you may want to be, I mean, if you go up, you've got to come down. So you're going to be doing both potentially. But it depends on if you want to target your cat's back end or your front end as to what you specifically encourage them to do. And again, ideally, and I appreciate we all have work, we all have life as well, not just our cats. But if you have the ability, what you want to do with the cat is not one big chunk of exercise. You want to do lots of little and often. So it may be you go upstairs and you leave them to sleep, and then you half an hour, 45 minutes, an hour later, you go, okay, now we come downstairs. Now we step over. Now we jump up. And then you leave them for another 20 minutes, another half an hour, another 2 hours. But you need to be at least, I would say, ideally 3 to 4 times a day, trying to actively encourage them, whether that's just playing with them, getting them to chase something, whether that's, you know, the bird chasing like feather toys on a stick. They're brilliant. Whatever your cat loved to do as a kitten or as a younger cat, resurrect it. Don't think that because they're old they can't do it anymore. They maybe can't do it for as long or as consistently, but little and often is the golden rule. Have we got any questions?
Hi, Kim. Thanks so much for a great topic. Yes, we do have some questions. Okay, let's start with the first one. So I have noticed some changes that you've mentioned in my cat's behaviour. What should I do next?
So I think in the first instance, you probably need to get your cat checked out with your vet, because they're the ones that are the experts in knowing, in being able to differentiate between, is this arthritis? Is this, you know, there's so many other things that can cause problems in the elderly cat. As I said before, you know, hypothyroidism causes muscle loss and weight loss. That can cause the stiffness and the difficulty in all of these, difficulty in rising and all of this other stuff, because they're weak. If you could do everything I've said, if they've got hypothyroid and it's not under control, then none of it's going to improve, and your cat is still going to be very sad and very unhappy. So I would always advocate a full check up with your vet with any significant behavior change in an elderly cat. Once that's been done and you've got the all clear, then crack on with any and all of this. I mean, a bit of play is never going to do them any harm, but if you've noticed significant behavior changes, get a GP vet to check first, and then we go from there.
Great advice, Kim. Okay, next question. I assume with problems like HCM, it's really important to liaise with vet around exercise, similar to how bursts of exercise may be serious for humans.
Yeah, absolutely. You've got to. So yeah, it's everything has to be. You're never going to, with an elderly cat, regardless of what their problem is, but especially like HCM and things like this, you're not going to do a marathon or a kitty equivalent of a marathon. It's little tiny bits, and you need to have a really switched on vet and to have good interaction, and potentially good interaction between yourself, a vet, and a physiotherapist, because vets are fabulous. They absolutely know what they're doing. They know way more than I do about all of the medical stuff, but I'm the exercise expert. So sometimes that helps for all of us to liaise together, just like we would in human healthcare.
Cool. Okay. How can we improve the muscle wastage over the hind limbs of an older arthritic cat? He is already on NSAIDs with a host of other conditions also in treatment for.
Go back and watch what I've just shown you. There's so many exercises. So things like the chest raises I was showing you, if he can still jump, do the jumping. If he can't, can I get back to, yes, here we go. So this picture here, this little girl, she's an elderly lady. She's absolutely gorgeous. This was her first session. When she first started, when I was trying to get her to go up onto this chair, because when she was walking around, she was quite low to the ground with her back legs. She didn't really want to stand up. And that wasn't nervousness. That was, as can be the case in a vet surgery, I felt that was more weakness. So we use Licky Licks. She was a big fan of the treat. This was a good thing. But if you notice that first picture, her foot is almost completely flat on the ground, all the way from her toes to her heel. That's not normal for a cat. But what you can do is you get them into the food, and then by the end, and this was only 30 seconds later, I'd got her up on her tiptoes in a position that was much more, or much closer. It's not perfect, but much closer to being normal for a cat. That's a brilliant strengthening exercise for her. And that's something that now I've got her carer doing at home. Okay, not necessarily with Licky Licks, but when you're at home, you can use lesser, so not quite as high quality rewards than I need to be using in my vet surgery in my clinic, because they're like, oh my God, I'm in a clinic, I don't like this. Whereas at home, you can maybe use a toy if that's their favorite thing, or you can use, if your cat loves catnip or whatever, use this to encourage them. Anything that you know your cat loves, that's the incentive. What I'm saying, basically, you can use treats. I'm not saying you can't use treats. Absolutely go for it. But what I don't want you doing is using treats to the level that they then end up putting weight on, because that makes the whole thing rubbish, basically. We need to balance healthy weight with strength. So that sort of thing, upstairs, that's going to help. Anything where they've got their, if you're looking at back end strengthening, sorry, I've just remembered the actual question. Anything you're looking at back end strengthening, you're looking at front end up, weight on the back end, trying to encourage them to do that. Anything you're looking at front end strengthening, vice versa, head down, bum in the air, weight on their front legs.
Do you recommend joint supplements for all cats or just whole ones?
I'm ambivalent about joint supplements, I have to say. The research is not overwhelming. There are definitely certain supplements. The omega oils tend to be the ones that seem to have the most efficacy, but I am, I'm more interested in good analgesia and strengthening. And that's not to say I would say never use a supplement, because some cats, some dogs, some humans respond really, really well to them. But it's not the first thing that I would put into my arsenal, I have to say.
How much success have you seen from Silencia?
That's a good question. I think it's the same as lots of drugs. I've seen some really good responses. I've seen some really good responses that have then tailed off. I've also seen some cats that have not really responded at all. If you look at where it's actually recommended, it's recommended in very early stage arthritis and with absolutely no neurological, the cat has to be completely neurologically normal. So you need to be confident that you've got nothing neurological going on, and it can have any level of arthritis. They can have any level of arthritis, but the recommendation is, the drug company that makes Silencia actually recommends that it's better for cats with early to moderate level arthritis, and I think it's probably being given more to the later stage arthritis, so I'm not sure it's ever going to be as effective as we hope it to be necessarily in those cases.
Okay, so the next question comes from an ACPAC physiotherapist. They say they've been a physiotherapist for 18 years and have never had an osteoarthritis cat referral. So the question is, how do you get vets on board?
Oh, that's really hard because work in a hospital, so I can just go around and nag them. Um, I think a lot of it is not necessarily that the vet won't refer, but maybe they think that physio can't do much for cats because I think that is a big assumption. I get asked a lot, oh, wow, you do cats? What? I didn't know that you could. And it's kind of like a light bulb moment to a lot of people. So I think education, if you've got, I mean, I think in the first instance, I just started on my own cats. And if you can show an improvement in your friends and family, obviously with your vet consent, etc., but case studies are the best thing in my book. If you can show them proof, then they're way more likely to go, oh, actually, okay. And the more they think, the more you can put the idea in a vet's head, the more they will go, oh, maybe physio will help, which is why I'm very, very lucky because I just get to sit and listen. I sit, my desk is in with the vets and I can just go, excuse me, I think physio might help here. And it can really help.
Okay, next question. My cat was diagnosed with arthritis in her hips 10 years ago at age 4, and it's been managed exactly the same the whole time. Does arthritis progression get quicker as cats age?
Not necessarily. It does progress. It is always a progressive disease. It doesn't necessarily get quicker. However, you the degeneration is going to continue to occur. It's not like it's so you may have the same rate of degeneration, but that's going on top of a joint that's gradually getting worse and worse and worse. So having exactly the same management might be fine for a fairly long time, but if you're then noticing signs and that your cat is no longer as active, no longer wanting to do, is reluctant, etc., then it's time to put in adjuncts, to put in the next thing, potentially to look at either extra drugs with your vet or different drugs, because sometimes a change in just purely their non-steroidal can sometimes help matters. If they've not been having physio, I couldn't, I mean, I granted very biased, but oh wow, that cat, if they've had arthritis from 4 years old, they desperately need physio. Even if it's a one-off consult that we go, do this, do this, do this, and then you go away and then you come back in another 3-4 years. But equally, I haven't put the pictures in here, but I do hydro on cats and I do cat and arthritis. So Aggie, the cat that I was doing massage there, she did hydro with me for every week for 2-3 months. And that made a massive difference to her. I had another cat who was old, arthritic, and horribly obese, and didn't really manage to lose much weight. So that I failed with completely, trying to persuade his carer, who was a vet, to help him lose weight. But we did weekly hydro, and she ended up having to get him a cat tracker because he went from being unable to jump onto the sofa to being able to jump their 6-foot garden fence. And she got very upset with me for the fact that he kept disappearing. But was also really happy that his quality of life had improved so much. So hydro can be a thing for cats. It would be, you'd be amazed. It's not just the fancy special breed cats that supposedly love water. There's a lot of your domestic short hairs, your good old moggies that will tolerate it as well. And it can be massively beneficial. If you look at our social media, I've been doing hydro recently on a lovely cat called Bo, who has hip dysplasia. So he doesn't have arthritis yet, but he's gonna, sadly. but wow, he's so much better with the hydro. It's fantastic. Um, and there's so many adjuncts. So while it's not necessarily bad that your cat's been managed the same way for many, many years, if their symptoms are altering, then that's the sign that something needs to change and be added on, or changed, or reviewed and looked at.
Great advice, Kim. Okay, my partner has an old anxious cat who is taken to urinating out of her litter box, mainly on one plus socket. We've since put cling film over the socket, which protects her. And it's more when she's stressed or the house is busier, but often in between two. My vet has prescribed gabapentin for pain. Is there anything else that we can do to help her? Any massages, anything else? She's happy for me to touch her, but the vets can't have a proper feel of her.
So everything I've shown you here, the massage, go for it. Everyone loves a massage. It doesn't matter whether you're painful, not painful, or anything. I don't know anyone that's going to say no to, or very few that are going to say no to a massage. So if your cat is happy for you to touch her like that, crack on. If you And the more you do it, the more there'll be bits that maybe she'll sort of move a bit more and sort of be a bit restless, but then sort of go, actually no, that's quite nice. And you may feel that part of her, some parts of her muscles are a lot stiffer than others, or just a bit hard, feel a bit harder. Heat, 100%. Try heat with her, then try the massage. Try all of these exercises, anything that you can, stretch, move, anything. The other thing I would really recommend is, I'm in one way I'm really lucky in that I'm in a hospital. In another way, I'm really unlucky as far as cats are concerned, because they react so much better in their own homes. If you go to ACPAT, which is the Association of Chartered Physiotherapists in Animal Therapy, so they are all chartered physiotherapists. So we are human qualified physios that have then gone on and done a master's level extra degree to be able to treat animals. A lot of them, there's actually on our ACPAT, if you just Google ACPAT, ACPAT, it will come up with our website. And one of the pages on our website is Find a Physio. And if you pop your postcode in and pop cat in as your species, a lot of physios will do home visits. And while it's not perfect, because it's still a stranger in your cat's house, they are usually 100 times happier with the stranger in the house, rather than having to come to a vet's where it smells wrong, maybe has dogs barking, has too many people talking, has all strange anesthetic-y, like antiseptic-y smells and stuff that they don't like. That's not to say that it's impossible. I have a picture right in front of me right now that is showing you the cat that very happily acclimatized with the right treat. But it may be that a lot of your cats that are stressed will be better with it in their own home environment. The other thing I would also really, really recommend, if you are getting an assessment from a physiotherapist, take videos of your cat beforehand, of the things you've noticed them struggling with, the things you're worried about, or even just them walking. Because if they're not going to show themselves to their perfection and their normal ability when a stranger comes to town and comes into their environment, show them. We can work stuff out. It's not as good as seeing them in the flesh, but it's a darn sight better than not seeing them move at all. And that can be really, really useful as an adjunct, both before and after, but especially before if we've never seen them before.
Thanks, Kim. Okay. Any comments on supporting a very old cat with severe bridging spondylosis, which is now causing constant incontinence? I'm doing a lot already, and he goes to the vet every month for his meds. Would be curious to hear your response.
My first thought would be massage, because I can't do any. If he's got bridging spondylosis, that means he's got bony changes that are permanent, and that I can't do anything with the bones and the joints. But all of those muscles are going to be having compensations to try and do the things that he's stiffened up and is struggling to do. As I said before, massage has quite a really quite strong analgesic effect if it's done regularly. So if he will tolerate it, whether that be from just you or whether that be from a trained therapist who could potentially teach you and guide you a bit more, or just from the therapist, depending on what you feel comfortable with, I'm pretty certain that would certainly make him feel more comfortable. I would also say it's very difficult because obviously all of these, I'm a physio, I'm always going to say, I need to assess them. I can't, but I'm giving you as many general tips as I can. But I would have thought that a physiotherapy assessment, because I'm almost certain spondylosis and spondylitis and bridging spondylosis, that's his spine. We can still help his back legs. We can still make those stronger. And if we can make those stronger and we can make the muscles feel more comfortable, we can improve his quality of life and improve your quality of life. I'm not saying I can do anything about the incontinence, unfortunately, but it depends on why the incontinence is occurring. It may be that it's to do with the spondylosis and it's an actual neurological thing, in which there's probably not a lot we can do. But if it's because he's struggling with his mobility, then it might be something we can help with a little bit, but we can almost certainly make him feel more comfortable in general.
Is there a time when it's too late to start physio? We sometimes have very elderly cats with horrible, stiff, and painful joints, not willing to move much at all. They seem so sore that analgesia may not be enough. Is there hope for these older cats?
I would never say never. Yeah. I think the thing is yes, undoubtedly there will be times when it's too little, too late, or not too little, but the physio is not going to be enough to help. But that needs to be assessed on a case by case basis. And that's a very individual thing. I've had cats and dogs, but obviously we're talking about cats here, that there was pretty much no hope for. And some of them haven't responded, and some of them have turned into a new cat and has a total new lease of life. It's one of those things that is unfortunately fluffy and airy fairy, and I have to say they need an individual assessment, but that's why I do my job. So yeah, but I'd never give up hope.
I have a 13-year-old cat with hind limb arthrodesis, and her other hind limb has been recently amputated. Are there any specific exercises you would recommend?
I mean, if she could cope with it, I'd get her in water, because that's going to be the best way to strengthen her. So specifically an underwater treadmill. I would get her doing hydro if she would allow it. If she won't allow it, then you're looking at doing things like the chest raises and anything to help her strengthen the remaining leg. I appreciate she's got an arthrodesis, but that's one joint rather than all of them. And we need to make that back remaining leg as absolutely as super strong as possible. And hydro is probably the quickest, and if she'll tolerate the water, most effective way of doing that most efficiently.
So I think we've got time for just one last question. And this question is, are arthroscopies an option? And if so, how much success do they have?
My answer to that is you need to ask a vet. And it depends on the size of the cat. The smaller the cat, the smaller the joint, the more difficult arthroscopies are. The reason would be, why would you need to do an arthroscopy? We tend to only do arthroscopies in elbows in dogs, going over to dogs, because that's the best joint to be able to visualize. So I'm not entirely sure why you would want to be doing arthroscopies in a cat. You can purely because cats have a much lesser incidence of elbow dysplasia, which is why we do arthroscopies in dogs. But it's not it's orthopedic vets. So I'm sadly not the person to ask that question to. I do apologise.
So I think that's probably everything for now. We have run over a little bit, but I hope everyone enjoyed the presentation. Thanks so much, Kim, for an amazing lecture. It was really enjoyable. And on that note, have a lovely evening, and thanks very much.